Alright, first thing you're going to do is gather all of your supplies. So you need your 2 Comfeel wafers, your tincture of benzoin, and your pre-cut ET tube tape. And you will have already spoken with your intensivist and let them know that you're going to be retaping the ET tube, and already given any additional sedation or paralytics that they ordered for this process. So step 1, you're going to take your Comfeel wafers and place them on the child's cheeks. These wafers will act as a skin protectant. They have a silicone-based adhesive, so when we go to take the tape off of the child's face, it'll protect their skin from skin tears. And it's also not permeable, so any drool that they have won't make those less sticky. Alright, for the next step, you're going to take your tincture of benzoin, and just so I don't make a mess on my mannequin here, I'm actually going to pretend and use swab sticks, or just the regular Q-tip tips, but pretend like these are the swab sticks. So we're going to paint benzoin on the entire surface of the wafers on each cheek, and most importantly, we're going to paint it across the child's kind of mustache area, making really sure to get benzoin in any folds of the child's face. We then need to wait a moment and allow the benzoin to dry. As it dries, it becomes tacky. If you try to tape on top of the wet benzoin, the tape is not going to stick. So we just have to wait a little bit. It dries pretty quick, and if you want to test it out, you can kind of touch it, and if it feels tacky, then you're ready to go. Alright, so the first piece of tape that you're going to put on your tube is what we call the H piece. For all of our tape, the long side is always going to be the part that goes across the child's face, and the shorter side is always going to be the part that we use on the tube. This little piece right here in the middle where the 2 pieces are attached, we call this area the bridge, and this area is going to go directly on top of the tube. So if our tube is in the right corner of the mouth, then this entire thing is going to be shifted over a little bit so that the bridge is right on top. If it's on the left corner of the mouth, we're going to have to shift it over that direction. For these purposes, we'll do it right in the center, so the bridge is going to go right over the center of the tube. The easiest way to get the backing off the tape is to make a little tear so that then you have something to grab onto. So we're going to peel the backing off of the tape. I've actually seen a lot of people do it this way, where they leave this backing on the bottom piece while they get the top piece on, and that seems to make things a little bit more easy. So I'm going to line up that bridge right with the tube, and this one's just going to go straight across the mustache. We don't want to pull it too tight. We want to make sure it really gets in there in all those little folds of the child's face, particularly that little notch right below the center of their nose. Then we're going to take the backing off of the bottom piece, and our tail should just be long enough to wrap around part of the tube, so it should really just wrap around about that much. It should not contact tape on the other side, because then that makes it extremely difficult to get the tape off when we untape. So we're going to go once around the bottom with this piece of tape, and then pulling the tape relatively taut, we are going to spiral up the tube, overlapping with each revolution, overlapping just a little bit, so that each time we go around, the adhesive makes fresh contact with the tube. And we're going to just tab a small corner, just like that. Your courtesy tabs don't need to be any bigger than just a small corner. Alright, so piece 1 is on there. It's already relatively secure. And at this point, whoever is holding your tube in place while you're taping is good to go to take their hand away. Alright, so for the next piece, we're going to use one of our Y pieces. These should be opposite of one another in the location of the angle. And so we're going to take our Y piece and peel off the backing. And again, the long side is going to go on the child's face, and we're going to line up the angle with the child's ET tube. So on this one, I'm going to go this direction, and we're going to overlap the tape that's already on the child's face. And for this piece, again, we're going to go once around the bottom and then pulling kind of taut so that it's nice and tight. We're going to spiral up the tube and again leave just a small notched courtesy tab. And ideally, this piece of tape makes a little bit of fresh contact with your ET tube above where your previous piece of tape was, so that it provides a little additional security. For our final piece of tape, this one is going to angle in the opposite direction from the previous one. So this time we're going to go this way. And the tape, again, we're going to angle it and kind of overlap the previous pieces of tape. Make sure that's all stuck really well down there. And I'm going to go ahead and go once around the bottom and then spiral up the tube. And again, ideally your tape makes a little bit of fresh contact with the tube just to provide a little additional security. So I'm going to notch for a courtesy tab there, and there we are, all done. So when you are all finished, it should look just like this, where you have your on your cheeks back to about your ears of your patient is how far back this should go. These pieces should all be overlapped on one another just a little bit. It shouldn't look like cat whiskers where they're all three separate. It should be overlapped just like this. And then going up the tube, you should have a nice tight spiral. And like I said, each piece of tape making fresh contact with the tube to provide additional security. So this tube is in there pretty well. No baby is going to be able to pull that out. There's no way for the tube to slide through the tape because of the multiple contacts of tape with tube. So that's how you tape an ET tube.